Hey there, and welcome to our explainer. Today, we're taking a deep dive into paroxetine, a medication that's been a major player for millions of people since the late 80s. You see, it's a really powerful tool in the world of psychiatry, but it comes with a very specific rulebook and some pretty serious risks that you absolutely need to understand. Okay, let's get right into it. This medication is a classic double-edged sword. On one hand, it can offer life-changing relief for so many people. But on the other, it demands a ton of respect and very, very careful handling from both doctors and patients. So, what exactly is this stuff? All right, let's start with the absolute basics. What is paroxetine and what's its whole deal in psychiatric treatment? So, paroxetine is part of a very well-known class of drugs called SSRIs. That stands for Selective Serotonin Reuptake inhibitors. It's been a go-to for treating depression and anxiety for decades now. And what that means is we have a massive amount of information on it. We know what it does well, and we also know about its unique quirks. Now we get to the really fascinating bit. What is paroxetine actually doing inside your brain? It's not as simple as just flipping a switch. Not at all. It's a pretty complex chemical dance that unfolds over time. Okay, check this out. It's actually a pretty cool process. Think of your brain cells as constantly talking to each other, but there's this little gap between them. To get a message across that gap, they use a chemical messenger called serotonin. Now, normally, after the message is sent, the original cell kind of vacuums up the leftover serotonin to use again later. What paroxetine does is it steps in and blocks that vacuum. The result? More serotonin is left hanging out in the gap, keeping that positive signal going stronger for longer. But here's a really crucial point. We used to talk about this stuff in simple terms, like fixing a chemical imbalance. Science has shown us it's way more nuanced than that. That immediate boost in serotonin, well, that isn't the whole story. The current thinking is that this initial change actually kicks off a much slower chain reaction, gradually rewiring how entire brain circuits communicate over weeks, even months. It's less of a quick patch-up and more like a slow, steady renovation of the brain's electrical grid. So, with that whole brain renovation idea in mind, what is this drug actually used for? Let's take a look at the specific conditions that paroxetine is officially approved to treat. And wow, the list is pretty long. It's definitely not just for depression. Paroxetine is brought in to help with a whole range of really tough conditions, from the constant nagging worry of GAD and the intense fear of social anxiety, to the intrusive thoughts of OCD and the deep trauma of PTSD. It just goes to show you how important that serotonin system is for regulating our moods and fears. Okay, but let's be real. A medication this powerful is gonna have a flip side. It's so important to know about the common side effects you might run into, especially in those first few weeks while your body is still getting used to it. And this is where things get kinda weird. It perfectly shows one of the trickiest things about this drug. For a lot of people, paroxetine is one of the more calming, even drowsy-making SSRIs out there. But for some, it does the complete opposite. It can cause insomnia, sleep problems, and some really vivid, strange dreams. It's a perfect example of just how differently we can all react to the exact same medicine. And beyond sleep, there are a few other very common things to look out for. Nausea is a big one right at the start, but that usually fades. The two that really stand out, though, are these. Sexual dysfunction is a really common side effect with all SSRIs, and paroxetine, in particular, has a reputation for having a higher chance of causing long-term weight gain compared to some of the others. All right, we need to shift gears for a minute and talk about the most critical part of this entire explainer. These are the serious warnings, the risks that anyone, even thinking about this medication, has to know, inside and out. This right here is what's called a black box warning. It's the most serious alert the FDA can issue. And what it means is that the data shows a small but very real increased risk of suicidal thoughts, especially when treatment first starts, for people under the age of 25. Now, this doesn't mean it's never used, but it does mean that incredibly close monitoring by doctors and family during that initial period is absolutely non-negotiable. So what about when you want to stop taking it? Well, paroxetine leaves your body very, very quickly. It has what's called a short half-life. Because of that, if you stop taking it suddenly, it can trigger a really rough reaction called discontinuation syndrome. And it is so important to understand this is not addiction. It's a physical response. It's your brain freaking out from the sudden chemical change. And unfortunately, paroxetine is notorious for causing one of the worst versions of this syndrome. The symptoms can be just awful. We're talking about intense dizziness, feeling like you have the flu, and waves of anxiety. But the most unique and bizarre symptom people talk about are these electric shock-like feelings in their head, often called brain zaps. It's an unforgettable sensation. And this is exactly why you can never, ever just stop taking paroxetine cold turkey. You have to work with a doctor to taper off it incredibly slowly. And finally, paroxetine doesn't always play well with others. This table here shows some of the most dangerous combinations. Mixing it with a class of drugs called MAOIs, that's an absolute no-go. It can actually be fatal. Combining it with other things that boost serotonin, like certain painkillers or even St. John's wort, can trigger a dangerous condition called serotonin syndrome. Even everyday painkillers like aspirin can increase your risk of bleeding. This is why it's so critical your doctor knows every single thing you're taking. So when you step back and look at the whole picture, the story of paroxetine is really a story of balance. It is, without a doubt, a potent and effective tool that has brought relief to an incredible number of people. But that power has to be constantly weighed against its very real challenges, the side effects, that brutal discontinuation syndrome, and the serious risks. The choice to use it really is the perfect example of a careful partnership, a balancing act between an informed patient and a knowledgeable doctor working together to navigate all the complexities.